And if you have any questions about it, please let me know and I can get you connected with Lori, who is the strategy lead here. So just spending a few minutes here on both of these, this work, and starting with financial stress. So the strategy is really to educate the community around housing as a social determinant of health, specifically with conditions within the home. As I mentioned, Lori is our strategy lead. And so that first timeline or update there is really important in the sense that in the first half of the year, we've had conversations. The initial financial stress work group had conversations with housing experts and those who are working on housing in Olmsted County, as that was kind of the original idea for the strategies to focus on housing. But just hearing all the great work that's existing, we decided to focus education around conditions within a home, or what makes a home healthy, so a healthy home. And after narrowing this focus, some of the highlights that Lori shared that they worked on was creating videos around the importance of radon water testing, nitrate testing at Grand Park and Olmsted County Fair, lead screening collaborative developed to increase the percent of Olmsted County children who are screened for lead, and then the upcoming publication of a website focused on the core areas of healthy homes, falls prevention, indoor air, safe drinking water, and childhood lead poisoning prevention. So jump into the next slide, please. Financial stress will continue to be a community health priority for 2023, because again, noting those priorities that we identified earlier start in 2024. So work will not stop. It will continue around these priorities, the mental health priority, the financial stress priority, and substance use. For financial stress, the following work is planned: creation and sampling a video of how to sample, a sharing of a video of how to sample your water, sharing of data to support falls prevention groups, and then expanding healthy homes education. As I said, not the subject matter expert at all on this strategy or this work. So if you do have questions though, please let me know and I can get you connected with our strategy lead there. And one other side note too, when we send out the minutes next week, we'll also be sending out these slides, so you'll get this wealth of information as well. So lastly, wanted to share updates on the substance use strategy. So since the 21 to 23 CHIP is the first time that substance use was identified as a community health priority, the strategy was identified as to build a foundation of a substance use prevention system in Olmsted County. Really the first half, we had representatives from our core agencies, OMC, Olmsted Medical Center, Mayo Clinic, and Olmsted County Public Health Services, really talk about goals for this project, as well as additional partners for the assessment. So how can we really bring people together to work on this work, particularly around substance use, and how can we bring people together to work on this strategy. In September, I personally met with the Chemical Dependency Consortium, which is an existing substance use collaborative or work group in Olmsted County, along with the group of and the list of partners who are identified, who Olmsted Medical Center, Mayo, and Public Health identified about this strategy. And then in December, we began monthly meetings to start working on this work. So you may be wondering, building a prevention system around substance use is kind of a broad topic. What does that mean? Well, this is our plan for the substance use work group, and we just were able to identify a lead at our meeting last week, so they'll be able to start taking this and running with it with the group. But really, it'll start with an assessment phase, looking from the end of this year to the end of next year. What we'll be looking at is assessing what have we done, what are we doing, and what gaps do we have, and even assets do we have around substance use prevention. And then the latter half of 2023 will really look at the data and use data-driven recommendations and recommend data-driven interventions of what we can do to address substance use. And then really toward the latter half of next year, being able to connect with additional community members and organizations for feedback on the interventions, really asking the question, especially what are we collectively willing to address and work on based on their recommended interventions from that assessment. So really trying to get that community partner and community member buy-in into the work that they'll do. And then with drug use being a priority for 2024 to 2026, this work won't stop at the end of next year, as we'll continue to work across the community in the group will to implement and evaluate those identified data-driven interventions. And I know that was a fair amount of information. Again, if you have any questions, about either of the strategies, they're the financial stress one or the substance use one, please let me know. So next, we will talk about the CHAPP descriptive statement. So shifting gears again here this morning. So over the last several months, really since toward the beginning of this year, we have a work group, which is the CHAPP Quality Improvement or QI Communications Work Group. So this consists of community members, members from a variety of different CHAPP partners, representatives from our core teams, core group agencies, and this work group has been kind of tasked with how can we increase community or community partners' understanding of the overall CHAPP process, because it can be a little convoluted at times. So what are some things that we can do, resources that we can share to make the CHAPP process a little bit easier to understand? And so the first idea or strategy that the group developed is this descriptive statement that's on the next slide. Please use this statement. Again, we'll be sharing out these slides with you all as you talk about the CHAPP process, maybe with your colleagues or clients or people that you work with, just to be able to have that unified message around what the CHAPP process is. So really thankful for the work group for creating this statement. So I'll just read it here. The community health assessment and planning process is about improving the health and well-being of residents in Olmsted County. Every 3 years, the community conducts a health needs assessment to determine Olmsted County's leading health priorities, formulate a plan to address the needs, and publish an annual progress report. Olmsted County Public Health Services, Mayo Clinic, and Olmsted Medical Center engage with these diverse partners across our community to lead this process. So this is a statement that was developed again, I think a great job by the work group who led that and kind of wordsmith this. And they're also, the work group just met on Tuesday and are in the process of looking at a visual to help pair with this statement moving forward. So again, any opportunity that you feel that talk about the CHAPP process or the community health needs assessment or anything along those lines, please feel free to utilize this statement. All right, I believe we'll next jump to our core agency updates. We'll open it up and I'll start. We'll start with Dr. Lynch since I see on the screen first. At Mayo, if you have any updates to share with folks.
Sure, yeah, I have just a couple updates that Sue and I have. Sue couldn't make it today. So in terms of things Mayo Clinic's been contributing to, right now there's a focus on the Southeast Minnesota Regional Crisis Center. And so far, Mayo's contributed $1.4 million to support the services to run the clinic for mental health and substance addiction. There's also been, in the last quarter, $550,000 given to its community contributions program to a number of local agencies that are working on the top priorities at our CHNA. One example is the landing services where $150,000 were dedicated. So that's where the priorities in 2023 are also going to be. Focus on areas of financial stress and access to care and mental health and substance use. Last thing is there's a new program called Mayo Clinic Cares, and it's something where employees can get time just like they do for trip time now for education, but they can do it for volunteering opportunities in the community. And so there's a new platform for that. So I'll put up a website in the chat where if you would like your organization to be one that needs volunteer needs, you can add that. And that way it can be distributed to Mayo employees who are interested. So I'm really excited about this opportunity, and I hope it gets more Mayo staff out in the community working with their organizations.
Great, thank you, Dr. Lynch. Appreciate those announcements, updates. Just looking at the order on my screen, I'll pass it to Holly with Homestead County Public Health.
Good morning, everybody. So I think we mentioned at the previous HAPP meeting that we had applied for a grant through ViewCare, and we were notified in October that we received that grant to support the CHAP process. So we're planning to use the funds for that to support health equity across the CHAP process, including support of strategy identification. So very excited about that, that grant that came our way for the CHAP process. Public Health is also currently producing an opioid data profile, which incorporates updated data that will be shared with the community and with HAPP partners at the end of January. So look for that from Public Health. The Credible Mind platform is garnering support countywide as a public-facing web-based resource. And we're also continuing to have staff trained in other mental health supports, such as mental health first aid. So continuing to expand our work and supports around mental health in the county. And then as the holiday time is upon us, we are anticipating further increase in colds, RSV, flu, and COVID-19 infections. So Olmsted County is also seeing an increase in families seeking testing and care in emergency departments for upper respiratory illnesses. So we have partnered with our healthcare providers, and they are expanding the number of primary care appointments available for people who have children with illnesses, and are recommending visiting primary care over emergency departments, which should be used for true emergencies. So those are the messages that I had to pass forth on behalf of Public Health.
Thanks, Holly. And I'll pass it now to Wendy in Olmsted Medical Center.
Hi, good morning. So yeah, a couple of things related to us and our work with this group. You guys are probably used to be seeing Sharon attend this group as well. She has since retired from Olmsted Medical Center, and as a result, we've kind of looked at how all of this is going to function within our organization. So I actually now have the privilege of leading this work here, and is now under our population health council to help govern and lead the work that we have going on here. So we're very excited about that. In the area of mental health, we're actually doing quite a bit of focus with our active aging program, and in particular looking at seniors in our rural areas. and our social services is leading the way to try to implement some new initiatives to help particularly with mental health in those areas. We have also been helping with CERC and participating in that group as well and supporting them from a financial perspective. Also, we continue to participate in the Southeast Minnesota chapter of NAMI and helping that particular organization as well as the Homeless Community Network. In addition to some other things, we've got quite a few things happening internally as well related to mental health. We're working on some suicide ideation, additional screenings and referrals, as we've seen an increase in that with patients coming to our emergency room with that particular diagnosis. So just trying to beef up the resources that those patients have available and making sure they get the care they need right away. And then we're kind of happy to report we're bringing back our K9 program. So that was very successful before COVID, and our K9 companions that we have around, which seems to be a really big hit with our patients. So that program will be coming back as well. Substance use, we have our MATS clinic has done a lot of great work. It continues to expand, continues to add staff, and be reaching out to the organization that way, partnering with lots of specialists in our organization and trying to have that holistic approach to how we manage substance use in those patients and what they're seeing. So we've done a lot of work related to that. We've got a grant for towns, which is tackling overdoses with networks to support our nursing care coordination and trying to, again, help beef up and offer some additional support for those folks as well. So those are my quick updates today. We're still trying to get my arms around all of this and figure out the best way to report off this stuff to you guys. So I appreciate your patience while we make a few changes here.
Great, thanks, Wendy. Appreciate it. A lot of great information in the chat. Dr. Lynch, if you're maybe willing to come back on, there's a question for you of who could organizations contact at Mayo if they're looking for volunteers?
Who, can you repeat that again? Who
could organizations contact at Mayo if they're looking for, or who could organizations contact at Mayo if they're looking for volunteers?
Yeah, you could certainly start with myself or Sue, and I think on that website itself that I put in the chat, I mean, I think you can enter information too, my understanding. So certainly any of those avenues could be effective. We'll make sure that information is there for Mayo staff.
Perfect, thank you. And yeah, absolutely. And people have started to put in the chat, which is awesome. This is the time to open it up for anybody who'd like to share any updates happening with them or their organization. Anna put a lot of great work about SHIP and applications for funding awards. Awesome. And Al with CMRC COVID vaccine clinic, very good. So if either of you want to talk a little bit more about that, or if there are other announcements that anybody would like to share, feel free in the chat, or unmute yourself and share. We have a lot of great group of partners here this morning to be able to share any updates or things that you would like to share.
Hi, Drake. It's Mohammed from Somali Community Resettlement Service. We have a vaccine event through Friday in Rochester in almost office located in our office. So I'm very happy to see today all of this and then the great news I have heard today and the good network. And thank you. I appreciate that.
Appreciate it. Thank you, Mohammed.
Good morning. This is April Suter with Family Service Rochester. Around the financial stress area, we're working with dads through our Father Project. on employment skills, and also there's behavioral and mental health pieces that go into that. In the Meadow Park neighborhood, we're working on some employment initiatives, and around the housing, we're working with both the residents and some of the apartment managers on the housing quality in the Meadow Park neighborhood. And then throughout Southeast Minnesota, we do a lot of mental health work, as you probably know, and we have, I think, 9 mental health professionals who are embedded in area schools as part of the collaborative around school-based mental health. And we have some therapists who focus on aging well and mental health with older adults.
Awesome. Thank you, April. What other announcements or updates or things that folks want to share with the group here this morning? All right. Hearing none, we'll move forward here. But if you do think of any announcements or updates that you want to share over the next couple days, let us know, and we can include those in minutes that we share out next week. And also scrolling through this chat, saw some good feedback on the CHNA as well. So make note of that and continue to capture that. And then if you do have additional feedback, of course, either that feedback survey tool that we have there on the actual dashboard, or if you want to individually reach out as well, feel free to do that also. So yeah, thanks Al for the joint study on racism as public health issue presentation as well. Awesome. Well, appreciate everybody being here this morning. Thanks to our guest, Virginia, sharing more about the dashboard, and then Katie, Kristen, Taylor for all your great work around the mental health strategy as well. Thanks, Dr. Lynch, for welcoming us here this morning, and Mary Claire for all the great behind the scenes work that you do to help these run smoothly. So really appreciate it. So thank you all for being here this morning and all the great work that you do as well. This is our last meeting for 2022. So our next HAPP meeting, continuing those same quarterly conversations, will be Thursday, March 9th, 2023, same time, 7:30, same place, Microsoft Teams. Appreciate it, everybody, and have a good rest of your week. Thank you.